My name is Kathy Tissington. I'm a nurse practitioner here at GLO that runs the Vitality program, where I use functional medicine to address your hormonal health needs. I've spent the last decade of my career specializing in hormonal health. My goal is to provide women and men with an enhanced level of hormonal health treatment options. Women experience a myriad of hormonal fluctuations through their life, starting in adolescence, pregnancy, perimenopause, menopause, and beyond. This complex hormonal landscape can, for some women, result in huge fluctuations in symptoms and their overall health. These symptoms are often brushed off, ignored, or the woman is left feeling belittled. As a result, they suffer in silence. My goal is to help women ease through this transition, finding optimal health through the fluctuations. Today, I want to focus on perimenopause and menopause. All women make this transition. For some, it's a really small transition and they barely have any symptoms. For others, it completely wreaks havoc on every aspect of their life and has a huge impact on their physical, psychological, and emotional well-being. This hormonal transition has a big impact on our health trajectory. We have estrogen and progesterone receptors on every organ of our body. When we lose our hormones, we see a decline in overall health and vitality. But with our longer life expectancy, it can have profound impacts on our health and quality of life. Thankfully, there are treatment options that can ease this transition. Unfortunately, not all women are offered these treatments, but my goal is to change that. Menopause is one day, 12 months since your last menstrual cycle. However, the transition to menopause, called perimenopause, can start as early as age 35 years. Just like puberty was a roller coaster ride, the transition to perimenopause to menopause is one also. However, we also have to add in the challenges of jobs and children and aging adults and the busyness of life. There's no test for perimenopause. It's based solely off of symptoms. There are over 35 different symptoms of perimenopause, and they range from things like heart palpitation, dry skin, sleep issues, irregular cycles, headaches, low libido, changes in muscle mass. The list is really long and varied for each person. And just because your menstrual cycle is normal doesn't mean that you're not in perimenopause. My personal journey from perimenopause to menopause has already started. I started to notice that I wasn't sleeping as well, I was more anxious, I had heart palpitations, and this was very cyclical. It was occurring for about 10 days before my menstrual cycle. I also noticed my cycles were regular, but they were coming every 21 days. Thankfully, I was able to reach out to another nurse practitioner colleague who specializes in hormones, and she prescribed me some hormone replacement therapy, and then I refocused on some lifestyle changes to help ease this transition. Many practitioners believe that the symptoms that you're experiencing are common and normal. I'm here to tell you that just because this is normal doesn't mean that you should settle for that, and that there are many treatment options that are very effective and can help ease this transition. You deserve better. There was a recent study that looked at the impact of perimenopause on mental health. What it showed was that there was a new diagnosis of anxiety and depression and a worsening of current diagnosis, and also that medications like SSRIs became less effective for some patients. This study also observed an increased risk and attempt of suicidal ideation in women between the age of 44 to 47. We can't continue to ignore the impact that hormones have, and if we don't address these hormonal issues, we leave women struggling with mental health that greatly impacts their quality of life. In perimenopause, we see great fluctuations in the highs and lows of estrogen, and generally our progesterone levels become quite low. Once we transition to menopause and have no period for 12 months, our estrogen levels are exceptionally low. This contributes to symptoms like hot flashes, night sweats, and vaginal dryness, which are the typical menopause symptoms. However, there are numerous other menopause symptoms that are often ignored. Other symptoms include brain fog, fatigue, musculoskeletal issues, heart palpitations, itchy ear, vertigo, burning tongue, loss of muscle mass, memory issues, loss of concentration and focus, and increased cholesterol is another symptom. There are numerous to list. Generally, it's thought if you don't have the common symptoms like vaginal dryness, hot flashes, or night sweats, you don't require hormone replacement therapy. However, then we're struggling with numerous other symptoms that may not be directly associated with our hormones, but can be influenced and improved with hormone replacement therapy. The key to treating hormones is to figure out which hormone is at the root cause of the symptoms that you're experiencing. There are 3 main hormones that I like to address: estrogen, progesterone, and testosterone. We want to target the right hormone with the right treatment at the right time. We always talk about hormone replacement therapy, but one of the other things that I like to call it is hormone optimization therapy. Our goal is to give just enough hormones to bind to the receptors to see an improvement of symptoms. What we don't want to do is give massive doses of hormones that flood the receptors, and then we're going to get downstream side effects. The birth control pill would be an example of a high-dose hormone therapy that wouldn't be appropriate in the perimenopause to menopause transition because these hormone levels are too high. We also want to utilize hormones that are considered body identical. Not all hormones are created equal. There's a lot of controversy around hormone replacement therapy. Biggest barrier to hormone replacement therapy for women is actually the lack of knowledge and education from healthcare practitioners. The second is the myth that hormones, specifically estrogen, causes breast cancer. Estrogen causing breast cancer is not that simple. There's a myriad of risk factors that are attributed to breast cancer formation that we need to address in each patient. Hormone replacement therapy is one risk factor, and it's a very small risk factor. We also want to be balancing the risks of the medication with the risks of not treating and the benefits to the patient. The Women's Health Initiative was a large study that was released in the early 2000s, and basically it was reported that hormones cause breast cancer and was detrimental to the health of women. At that time, all healthcare practitioners and patients became frightened of hormone replacement therapy and stopped taking it. This had a very negative impact on the health trajectory of women going through perimenopause and menopause. Unfortunately, 20 years later, some of that data is still out there. Even though there has been numerous studies that have looked at that data and made different conclusions that are more accurate, many healthcare practitioners still quote the initial recommendations from that study. This has resulted in many women not having access to appropriate evidence-based hormone replacement therapy during the menopause period of their life. Thankfully, there currently is a movement on social media by some very influential individuals that are trying to re-educate women and hopefully healthcare practitioners about the benefits of hormone replacement therapy, allowing more women to access this really life-changing therapy. As women, we should be educating ourselves on hormone replacement therapy and menopause and advocating for ourselves with our healthcare practitioners so that we can get the appropriate evidence-based treatments. As women, we often think about estrogen and progesterone as our hormones. However, testosterone plays a really significant role and it's often overlooked. Recently, I was consulting with a patient and we were looking at their lab results. The normal reference range for their testosterone level by their lab was 0 to 2. My question was, how can 0 testosterone ever be good for any women's health? Another frustration around testosterone is that there is no commercially available testosterone replacement therapy for women. We always need to compound it at a compounding pharmacy. Testosterone has numerous health benefits that include muscle mass and strength, bone health, libido and sexual function, mood regulation, cognitive function, energy and vitality, cardiovascular health, and metabolism. If we want to age well as women, we need adequate testosterone levels. Testosterone is associated with bone health, which is associated with osteoporosis when we have low bone health, and it's also associated with our muscle mass and strength. We know muscle mass has a huge impact on the aging process, and in fact, we see an association with decreased quality and quantity of life as muscle mass decreases as we age. So as women, in order to age well, we want to do everything we can to protect and maintain our muscle mass, which will help us improve quality and quantity of life. Having adequate muscle will help improve health span and lifespan. Good hormonal care requires us as practitioners to have enough time to sit with our patients and listen to symptoms. I also like to monitor the levels of hormones in my patients. It is fascinating to me that hormones are not recommended to be monitored in women. However, when we're looking at men and men's health, we always monitor testosterone levels and we dose based off of those levels. There's minimal controversy around that. However, when it comes to women, it's just thought that we don't monitor levels. There's a few keys around monitoring levels in women. When you're cycling, you need to do it at a certain point of your menstrual cycle. In menopause, that's less relevant. The reference range for women's hormones, like estrogen, is massive. What is normal for one person will be abnormal for the next. That is why we can't just look at the lab values. We need to pair that with the patient's story and their symptoms. Most women are offered the exact same prescription for the hormone replacement therapy, but we're all unique and we require variable dosing. That is why it's imperative that we listen to symptoms, test levels, and adjust based on your unique needs. Also, not ignoring testosterone levels. We know that insulin has an impact on our insulin sensitivity. So when we lose our estrogen, we become more insulin resistant, and insulin is a fat storage hormone. When we develop insulin resistance, it prevents us from burning fat for fuel, it impacts the muscle function, and it makes us feel hungry all the time. We can also become resistant to weight loss. Insulin resistance impacts 3 key organs: our adipose or fat tissue, our liver, and our muscle. When those organs are impacted, it can lead to dysfunction and medical issues, including non-alcoholic fatty liver, high blood pressure, diabetes, hypertension, and high cholesterol. When we have low testosterone levels, it results in lower muscle mass, and that muscle mass isn't as healthy, so it won't uptake the glucose as well. We get less nutrient sensing in the muscle, and it impacts our metabolism also. This can result in weight gain. Estrogen has a huge impact on cardiovascular health. In menopause, we lack estrogen levels. Lack of estrogen is correlated with increased cardiovascular risk. In fact, the number 1 cause for fatality in postmenopausal women is cardiovascular disease. Postmenopausal women see an increased risk of diagnosis of high blood pressure, high cholesterol, and diabetes, and they also see an increase in weight gain. Anything that we can do to help prevent those diagnoses is imperative for women's health. Estrogen also has a huge impact on our cognitive health. I've had women in my clinic wanting to quit their job or take a demotion because their cognitive health has changed so substantially through their menopause transition. We see a decline in memory, concentration and focus, word finding for some women, and this can greatly impact their ability to function on a day-to-day basis. There are even some studies that link early menopause with an increased risk of diagnosis of dementia later in life. If you're interested in learning further about the role of estrogen in cognitive health, there's a great book called The Excess Brain by Lisa Mosconi, who's doing a lot of research in this area. Most women are aware that estrogen has a big impact on their urogenital vaginal health because we always hear about vaginal dryness associated with menopause. When we lose the estrogen to our vaginal area, we develop a very thin, dry vagina that bleeds easily, which is why we can get a lot of pain with intercourse. Estrogen also causes a loss of collagen and elastin to the vaginal area. This can result in prolapse to the area and issues with urination, urgency, frequency, and pain with voiding. We need estrogen to our vaginal area for it to function optimally. Estrogen also plays a very important role in our gut health. We have something called the estrobolome, which is a part of our gut microbiome. When we lose our estrogen, that part of our gut microbiome becomes abnormal. We then see a correlation of an increased risk of osteoporosis and cardiovascular disease. Some women, unfortunately, experience all of these symptoms, so we need to have compassion for them. When we talk about hormone replacement therapy, there's conventionally available hormone replacement therapy and also bioidentical hormone replacement therapy. Bioidentical hormone replacement therapy is compounded specifically for you with unique dosing at a pharmacy. I prescribe both hormone replacement therapy and bioidentical hormone replacement therapy based on a conversation with you about your individual goals and wishes. Both are equally safe and effective. At GLO, My goal when I see you is an individualized approach to your treatment plan. We're going to start by testing your baseline serum levels of hormones. You're going to complete a 15-page intake form, and we're going to go through that in great detail. After reviewing your symptoms and your blood tests, we're going to come up together with an individualized treatment plan. If you choose to do hormone replacement therapy, we're going to review your individualized risks and benefits associated with treatment. I'm going to give you a prescription for medication, and then we're going to see each other at 3 months after you've done some follow-up lab work. Because I don't use a one-size-fits-all approach, I'm going to give you a prescription, and then we're going to need to tweak that based on how you're feeling. Knowledge is power. If you're informed about menopause, symptoms, and treatment options, then you have the capacity to make decisions that work best for you. Good menopause care isn't just about prescriptions for hormone replacement therapy. It's imperative that we address all lifestyle factors. We're also going to look at nutrition and exercise and sleep and emotional health. Your thyroid function is off. I can give you a prescription for hormone replacement therapy, but if we haven't addressed those other areas, you're just going to not reach that optimal health that we're aiming for. There are some key lifestyle changes that we really want to start doing right away in all women. These include focusing on building muscle mass, so getting back to doing some weight training. Nutritionally, we want to focus on eating whole foods and prioritize protein and fiber in our diet. There's likely going to be some key supplements that we're going to add in for you to be taking daily. We're really going to focus on your sleep because good sleep is the foundation of good health. If you're not sleeping, nothing else matters. We can't control the stress in our life, but we can control how we manage that stress. And we're really going to focus on good, effective stress management strategies and self-care. We're also going to look at our emotional health. Do we have purpose and meaning and joy in life? These are all important ingredients into optimal health. Hormone replacement therapy can be life-changing. We want to do everything we can from a lifestyle perspective to optimize our overall health and longevity. At GLO, I also focus on longevity medicine. This is something we will add into your treatment plan when you're ready. These are things like infrared saunas and cold plunging and peptides and all the other great things that you can be doing to further optimize your health. I view health as a pyramid. We want to start with a really good base. Sleep, supplements, nutrition, exercise. Then we're going to build from there with supplements and prescriptions and then everything else on top of that. If we don't have a good base, we can add all the things above that we want. We're not going to be able to reach our optimal health goals. Ask yourself what aging looks like to you. What do you want to be doing when you're 80 years old? For myself, I still want to be out in nature, climbing mountains, mountain biking, running with my grandkids, and I know that everything that I'm doing right now as a woman approaching 50 is imperative to reach those goals when I'm 80 years old. My goal is to work with you on your individual dreams around aging so that you can realize those health goals for yourself. I want to be a partner with you in your health journey to help you age gracefully, whatever that looks like for you.